The overall concept of screening embryos to see if they have the right number of chromosomes or the wrong number of chromosomes, aneuploidy, has been quite controversial in our field now for over 20 years. I think everyone recognizes that if the embryo has too many or too few chromosomes in all of its cells, that's a bad thing. It's not going to make a pregnancy very often, and it does not make healthy pregnancies ever. However, the ability to diagnose that, to do that in a reliable way without harming the embryo, has been something of great debate. Early studies biopsied embryos earlier in their development. That's been shown to be a bad idea. It's now been shown quite definitively that you can biopsy at the blastocyst stage, day 5 or 6 of development, very safely. After that comes the technology used to evaluate that tiny little sample to see whether or not it's reliable, and of course whether or not that actually improves pregnancy rates and outcomes. There was a recent trial, the STAR trial, which had quite disappointing results. This is in distinct contrast to all the randomized trials done with the more contemporary technologies in the last years. There have been 5 or 6 others which showed benefit. And I think it's important to keep the findings of the STAR trial in context. It was a large trial. It involved many laboratories, many centers all over the world, but it used a specific diagnostic technology. The other trials have typically not used that technology. I think the simple conclusion is this: the technology used in the STAR trial probably does not work. It is not precise enough. It does not give an accurate result often enough to benefit patients. That does not mean that other technologies do not. It is many examples in medicine where one approach to diagnosis does not work well, but others work very well. This is a simple example of that. Some investigators, scientists, qualified people, and many in the lay press have used the more negative outcomes from the STAR trial to then say that nothing in aneuploidy screening works. Nothing with PGTA could be of benefit to patients, and that is ridiculous. The reality is there are very high quality randomized trials that have been done that show clear benefit. Furthermore, there are non-selection studies. These are ones to determine whether or not the accuracy, the diagnoses given these embryos are in fact accurate. And they have shown recently, once again, in an additional trial, that they are highly accurate and highly predictive of clinical outcome. So I think the take-home message for our patients and for members in our referral community and within the professional community is the particular approach used in the STAR trial is largely unsuccessful. The approach used in other trials remains highly successful and beneficial to patients. Don't criticize the entire field because one approach unfortunately did not work out. Simply return to those things that did work out, where we're attaining outstanding clinical outcomes, benefiting our patients and making healthier babies.